This is Michelle Jane Sevilla, first year nursing student from Davao Doctors College. Today I am going to perform a return demonstration for a complete bed bath. So complete bed bath performed to physically wash or clean the dirt and microorganisms from the skin of critically ill patients or reducing infection risk. So prior to the conduct of the procedure, I have performed hand washing to protect my patient and myself as well from infection and cross-contamination. I have closed the door, fixed the curtains, adjusted room temperature, and provided adequate lighting to ensure comfort and secure patient's privacy. Next, I have prepared the necessary equipment needed. These are the basin with warm water, liquid soap, washcloth, back blanket and bath towels, moisturizing lotion, deodorant, working gloves, and a hair comb. But before I start the assessment, I will greet the client politely, introduce myself, verify the patient's identity using two identifiers, which is done to make sure that I am doing the right procedure for the right patient, and of course explain the procedure that I'm about to do. So hello ma'am, my name is Michelle Jane Sevilla, your student nurse for today. And for some verification, can you state your name and your birthday please? Thank you ma'am. And today I'll be doing a bed bath, which means that I'm going to wash your body and remove the dirt and oils or perspiration in your skin, and of course for you to feel refreshed. Will that be alright? So now I'll begin. So would you like to void this time? Okay. So now I'm going to get my gloves done. So in a hospital setting, naturally I'll have to raise the bed to a comfortable working height and lower the side rails at my side. So now I'll assess the patient to move closer towards me. Can you please move? Now put a black back blanket over the patient. Now remove the top sheet that is below the back blanket. And now put the linings to the laundry hamper. Now remove the patient gown. If the patient has injuries or reduces mobility at one side, then I shall start at the unaffected side. So after removing the patient's gown, now we have warm water, 2/3 full. It is about 43 to 46 degrees Celsius, and we'll let the patient check the temperature if it is tolerable to them. Okay, now I want you to check the temperature if it's warm for you. Is it okay? Okay. Now I will remove the pillow and place the bath towel under the patient's head. Over her chest. Now ask the patient if he or she wears contact lenses. So miss, do you wear any contact lenses? Okay, so now I'll start with washing her eyes and dip the cloth in the water and fold it to create a band. So I will start from the inner canthus to the outer canthus. And now let's proceed to wash the forehead, cheeks, nose, ears, and neck, and also ask the patient if he or she wants to put liquid soap. Do you want to put any liquid soap? So if the patient is unconscious, wash the eye with warm water only. So starting from the inner canthus to the outer canthus, using a separate section of the cloth for each eye. And now, I will use eye drops if it is prescribed. So if the patient has no blinking reflex, leave the eyelids closed and place an eye patch gently. Now let's proceed washing the arms and hands. Place the bath beneath the patient's arm. Using firm strokes, start from the wrist to shoulders, including the axillary area. Now raise the patient's arm and support the patient's wrist and elbow. Okay, now apply deodorant for the patients with respiratory alterations. Now wash and clean the other side of the arms. Now let's proceed to the chest. Place a bath towel over her chest while I lower down the back blanket just above the umbilicus. Now using a bath net, start cleaning the patient's chest. Special attention to the skin folds because these are areas are very prone to sweating or perspiration, also known as the bacteria. So if the patient is female, special attention to the skin beneath the patient's breast. Then check and change the water if necessary. So now let's proceed to the abdomen. Place the back blanket downward to her pubic region. Start washing the patient's abdomen and also pay attention to the umbilicus and surrounding skin folds. Now let's proceed to the legs. So in order for me to wash the legs, the first thing to do is to expose her legs by folding the back blanket to the midline and then place the back towel beneath her legs. So using a long firm stroke, I'm going to wash the legs starting from the ankle to the knee, and from the knee to the leg. So check for any skin redness, swelling, bruises, or pain. Also special attention to the toes and tunings. Now do the other side of the legs. So discard the washcloth and maintain patient's privacy. Then refill the basin with clean water. So changes clean pair of gloves and applies perineal care as necessary. So now soaking the patient's feet in warm water for 10 minutes will help maintain cleanliness in feet and toenails, but we should remember to not soak their feet if the patient is diabetic, because this might actually cause harm or injury. So now I'm going to turn my patient into a prone position. Okay, ma'am, you need to move your body in a prone position. So place the bath towel at the side of her back. So start cleaning the patient's back, buttocks, and pay attention to the patient's skin folds. If the patient's skin is intact, remove and discard gloves used. Now ask if the patient wants to have a massage. So miss, do you want to have a massage? Okay, now if not, I will put a moisturizing lotion at the back. Okay, miss, you can now roll back. Now put the patient's clean gown. And comb the patient's hair. And now let's put on a pillow. Okay, ma'am, how are you feeling right now? Do you feel refreshed? Okay, that's good. So since we're done, I'm going to head out now and let her have some rest. So if she needs anything, please don't hesitate to call me or ask me some questions, or to call the button right here. And alright, so have a nice rest. So then I'm going to clean the table to maintain cleanliness. Then after that, I will perform hand hygiene and document the procedure that I have done. Now we are done with the assessment. Thank you and God bless.